Thank you so much, Kathy. And thank you very much to Pierre and the IMI team for inviting me here. You're a very hard act to follow, Martin. There's very little that you've left unsaid. But IMI does really two things for me whenever I come to an IMI event and a stakeholder event. It both reassures me and it excites me a lot. It reassures me because we have more than now we have 11 years of proof that we can collaborate and that the sum is greater than the parts. So we have now 11 years of working together and cracking a number of things that alone we didn't manage to do. And as I'm a big fan of collaboration, having an actual living proof of it reassures me. It excites me because the prospects are endless, and because, as you've heard throughout the day, we have not only IMI 1, IMI 2, but also a future health PPP that we're working on, where we're going to expand even further and try to involve even more organizations and even more sectors in trying to crack the various nuts we have to. So it's really nice to be on the cusp of this, but it's also nice to be reassured that we're not embarking on something completely blue sky and impossible to realize. We have proof that we can, more than 100 projects that have given good output. So that's great. And I think that the choice of the area of the discussion today is that brain research is probably one of the most complicated areas of research that there is in health. And so what better area to focus on and to show how IMI can bring added value is a combination of biology and technology should unlock a number of paths. But whenever any of us have tried to do it on our own, we've failed miserably, I would say, and not so much for our failure, but for the patients who are waiting for solutions or even just to be diagnosed, as Martin said before. So I think the collaboration, across disciplines to make the best use of data generated, and we heard from Despina and others this just earlier today, upstream and downstream of R&D to improve outcomes across sectors, so integrating the different technologies and the products. We've done it already in IMI 2, and we can scale it up even further in the cross-sectorial next edition of a health PPP, whatever we call that. I heard some acronyms already, so IHI, I don't know. And then obviously across the public and private spheres to really create that knowledge and accelerate the translational research. We're often very good in Europe at our fundamental research, and we're less fast and less effective in translating that research into products, and other regions tend to feed on us rather than us being able to carry through. So I think today's themes really illustrate very much the challenge not only for the brain disease area, but for many chronic diseases, and it's how to prevent in a smart way, how to diagnose accurately or even at all, how to intercept before it's too late, so that the treatment that you bring is not the most expensive, but the most effective as well. How to treat effectively, and then how to bring more quality of life. And very often the outcomes that patients are looking for from treatments are not necessarily the endpoints that we are measuring, certainly from a pharmaceutical industry, but even in other parts of the healthcare system. So much has been done in IMI. We've broken down silos, we've made progress, and because we've looked at problems systematically from different angles, because we're coming from different parts, of course. And I think we're not there yet. A lot remains to be done. I think even a lot remains to be done, and then a lot more can be done. And I was listening to this last panel, and so many new ideas, even just the idea of connecting Excel and whatever the next, or whatever called next, is, I think the synergies are incredible there. And a lot of the suggestions that we heard today, we're going to take back. Not only EFIA, but I know the IMI office and all the different big parts of this public-private partnership. And under Horizon Europe, with our technology colleagues and the pharma industry on an equal footing, we're really going to try and build on this and move to the next stage. And that means integrating technologies and know-how for better health products, which is a little bit what we've already done in IMI perhaps, but integrating also products and services for better health outcomes and the optimization that you were mentioning before, Martin, of healthcare systems, which is really, I think everybody's goal is providing solutions for patients, but doing so in a sustainable way that means that healthcare systems are in a good shape today and tomorrow. Integrating the clinical and the societal and all the informal care workflows to improve the patient journey, because very often, and certainly as an industry, we've been reminded that we focus very much on how our products impact patients, but we forget that the patient goes on a whole patient journey and needs to be accompanied through there, and we need to optimize the experience for the patient, not just the outcome at the end. And then integrating the business models to actually enable us to work together, because we're not used to working together. We've been breaking silos, but it doesn't necessarily mean that it comes easily to any of us. So I think, as I mentioned, IMI really was the pioneer, has been the pioneer. 11 years is a long time to be a pioneer, so I'm reassured that it has delivered what it was supposed to deliver. The industry is really ready to go to the next level, to integrate different sectors, to work together. It's not simple, because we as the pharma industry have worked in IMI for 11 years, but the other sectors haven't necessarily worked in a public-private partnership setting. There are lots of questions that still need to be dealt with, and I have to say it's been really encouraging to be able to work with the institutions on, cracking even those operational nuts that we need. But I think certainly everybody's committed to getting there. We have proof that it can work, and the problems are so big to solve that nobody's going to back down from that right now, and the institutional support is also extremely important, not just at European level, but at national level. So we hope really that the research and patient communities, as well as policymakers, are going to support the endeavors to create the next health public-private partnership, so that we can make sure that the sum of even more parts, because there'll be even more parts, will be greater than the individual parts, and that we can really make substantial progress in many areas, not just brain disease, but in particular brain disease, where we don't seem to be getting as far as we would like to. I'm going to stop here. I know I'm the last speaker of the day, so thank you again for the invitation, and have a lovely evening. Thank you.